Morning to everyone. So I welcome you all to this session of clinical management of common skin disorders in bovine. So first of all, I would like to apologize for the delay in login because of some technical issues. So I apologize for the delay in login the session. I'm very much thankful to my teacher and my the association dermatology association of veterinary dermatology president Dr. Narajan sir for his motivation and giving me the opportunity for delivering this webinar session regarding the skin disorders in bovine. So I dedicate this session to Narajan sir. So because dermatology is a very big entity. So dermatology is a very big entity. So among that, small animal dermatology and large animal dermatology is like a ocean. So when we want to go into a subject in deep subject, so we have to explore everything. So according to Dr. Narajan sir's purview, so dermatology has to be a separate entity and it should cater the need of all the veterinarians. So we should explore more things and we have to go on the evidence-based treatment. So that is the main aim of starting this Association of Veterinary Dermatology. So under his guidance as a president, it's started delivering knowledge about the dermatology, both small animal and large animals. So when we discuss with our friends, so regarding the, so can I able to see the screen is moving? Yeah. So when we discuss about dermatology, so sir asked me to prepare for a large animal dermatology class. So we can have a session on large animal dermatology. So when we are discussing with my friends and other practitioners, sir, what is that in the large animal dermatology? Simple thing. All the dermatology cases we can treat it with only ivermectin. There is no need of any other treatment. Then what is the need of dermatology and all that they discussed? So, but now the trend has been changed. So, according to the need of the farmers, even though it is not direct, many of the dermatological conditions of large animal, even though they are not directly involved in the loss of production, people are highly influential and thinking about the aesthetic also. Even a small dermatological problem in large animal, they are bringing to the hospital and they are expecting good results. So this session is not a lecture class. I'm repeatedly telling you this session is not a lecture class and this is a learning process. So this is a learning process of dermatology and this is the first step. We are learning some few conditions. So when we discussed about involving some, what are all the cases we can include? What are all the cases we can include in this session learning process? So sir told me you take some few cases from 5 or 6 cases so that we can discuss about that. So I thought about my practice and during my common practice, what are all the cases which I come across. Then collectively I got about some 5 to 6 cases and collectively then at last when I was putting the PowerPoint for the discussion, it came around 200 slides. So then only we came to know even a few 5 or 6 cases discussion is coming like 200 slides means think about the other conditions of large animal dermatology. It's like a very big area. So it's not at all we can cover in a single session. So we can cover it in various sessions like part 1, part 2 like that. So here we are going to deal about the very few conditions, 5 or 6 clinical conditions, so that we can be aware of these conditions so that we can treat it accordingly. For example, a farmer is reporting that his cow is having skin problem since 1 month and was referred to a veterinarian for treatment. So the farmer is bringing the animal to the veterinarian and he is telling some dermatitis is there. So sir, my cow is having some dermatitis problem, that's all. So he cannot say the technical name or he cannot say any other thing. Just he is telling it's having dermatitis. So we the veterinarian have to go in depth of the knowledge and see the lesions, appreciate the lesions. Then you decide what are all the samples you have to get or by our own experience by appreciating the lesions, you can identify this is a fungal, this is a mange or this is a lumpy skin disease or this is a dermatophytosis or this is some other conditions. Like that we have to identify and then treat it. Then only we need satisfaction. We will be having satisfaction. Otherwise, we will also the same condition. We will be seeing the same cow as a dermatitis, and if you are giving ivermectin or treating it symptomatically, there is no need of any point of successful treatment. So only this webinar is a learning process in the large animal dermatology. So in a due course, we will be dealing with more number of cases. In due course, we will be dealing with more number of cases so that we will get exposed to many number of clinical conditions. So as a veterinarian, we should be able to diagnose the case as not dermatitis, but as a maximum narrow down the etiological diagnosis by application of our clinical examination and use of some diagnostic procedures and response to the treatment. So these three things are the main important. First thing is the clinical examination. Appreciate the lesions, where all the lesions is there, whether there is any pruritus is there or not, whether the animal is having hair loss is there or not, what about the distribution of the lesions. Like that, we have to take about the clinical examination. Then what are all the samples we have to collect? The diagnostic procedures like skin biopsy, scraping. Skin scraping is the basic thing in the dermatology, and any other cytology, FNAB, all these things we have to think about. And other things, according to our previous experience, we will be treating the case just by seeing the clinical sign. That is the response to the treatment. You will be thinking that this type of case, by appreciating the lesion, it is dermatophytosis. So you will be treating with for dermatophytosis and we will be getting response. So based on our experience and the response to treatment, we will be. So as a veterinarian, we should know and we have to train ourselves to narrow down the etiological diagnosis and application of our clinical knowledge in the successful treatment of dermatology. So the etiological classification in large animal dermatology, same of small animal also. In large animal, its etiological classification comes under fungal. It's a fungal dermatology is there, parasitic dermatitis, bacterial involvement, etiological case of bacterial, viral like lumpy skin disease, malignant catarrhal fever. All these things causes viral disease causes skin manifestations, and environmental etiological classification that leads to photosensitization and other type of skin lesions, immunological skin lesions, and nutritional related like copper and zinc, all related skin disorders are there. Immunological means that sudden related to any type of adverse reactions or drug related adverse reactions or any other immune mediated skin disorders. And neoplastic and non-neoplastic growths are commonly seen in large animal like wart, papilloma, and all other neoplastic growth are causing skin disorders in large animal. And also there are many number of congenital and hereditary skin disorders in large animal that we may be seeing in our field practice. Sometimes the calf may be born with hairless calf, and some other congenital anomalies. Hereditary skin diseases are very common, and miscellaneous so many other skin diseases are there. So as its classification itself is go as a long, very broad classification. So in this learning session, if you are including all the dermatological conditions in a single webinar as a learning session, we will get confused. Really, we will get confused. So we have selected a very few common clinical cases, skin disorders which are coming in the field conditions, so that you can just by seeing the lesions, you can appreciate the lesions and you can identify the condition and you can treat it accordingly. Sir? So what are all the diagnostic procedures? What are all the diagnostic procedures available? First thing is the skin scrapings. So the skin scraping, trichogram. So I will tell you how to take the skin scraping and all. Trichogram means the evaluation of the hair follicle. Just you have to plug a hair and put it in a slide and put a drop of mineral oil or liquid paraffin or just a drop of water or saline or water and put a cover slip and see it under low power microscope. Just that evaluation of the hair follicle is called trichogram, and in some cases we will be taking for a culture and sensitivity. When case of any pyoderma, recurrent cases of pyoderma or intertrigo, will be going for culture and sensitivity. Wet film examination, just take a drop of blood and put a cover slip and see it under low power microscope, and sometimes the lesions you can directly scrape it and put it in a slide and put a cover slip, and you can see directly for any wet film examination. And impression smear means just take a slide and impression may be taken from the particular lesions so that it can be examined and very well. All these things can be done in our dispensary itself. So culture and sensitivity, you can send it for any laboratory. All other things like skin scrapings, trichogram, and wet film examination, impression smear, all these things can be done our dispensary itself or in the field practice itself. Unless we have a microscope, it's very easy to see. And suppose if you have any growth, you can take about a fine needle aspiration biopsy. And skin biopsy is also very much useful in large element dermatology. I'll tell you how to take and all. So when the first thing, whenever you are taking a skin scraping, so always the selection of the lesion is very much important. You select a lesion site and you can take a steroid, that new BP blade or a ordinary blade. Only the thing is that the blade should be perpendicular to the lesions. You just see the picture. You should not keep it as a slanting. The blade should be perpendicular to the lesion, and apply some liquid paraffin and you can scrape it. Just you can scrape it and you can take the material and you can put it in the cover slip and you can see it. See that. So just you can apply liquid paraffin and hold the lesions, select the area, and the blade should be perpendicular to the lesions, and just scrape the area. So just scrape it and take the material and put it in the slide with the liquid paraffin and put a cover slip, and you can see it under low power microscope for any presence of mites, like anything is available, like Sarcoptes, Soraptes, Choreoptic, any other mites are available. That it's very simple. So whenever you have the facility of a microscope, just do it. It's a very simple technique. Only the thing, you have to take lesions from 1 or 2 sites and you can evaluate. Okay. This is the skin biopsy needle. So this is a punch biopsy needle used for taking a skin biopsy in large animals. So first thing we'll see about a condition is a fungal, that's a dermatophytosis. It's caused by Trichophyton verrucosum. It's a zoonotic importance. Here there is no pruritus. There won't be any intense itching will be there. Only the appreciable lesion is that the raised thick grayish white crust-like lesions. I means raised thick white crust-like lesions are visible. For example, you might be coming across this type of lesions in your practice. Sometimes it may be noticed around the eyes or some other parts of the body, and mostly it will be seeing the young ones. It is a self-limiting disease. So this type of lesions will be coming across in the clinical cases commonly. For example, spectacular eye, for means in the copper deficiency, it is alopecia. So if it is alopecia, you can say it as a spectacled eyes because of copper deficiency. So here the lesions are raised lesions, crust-like lesions, whitish in nature, whitish to grey color in nature. The crust-like lesions are typical of dermatophytosis. So here you can able to appreciate the lesions all over the body here, and the forehead and ears and the neck region. And when you can able to appreciate the lesions, you can term it as a dermatophytosis. And the diagnosis based on the appreciation of the lesions and the trichogram and culture. So appreciation of the lesions mean by seeing the clinical signs, and trichogram, I mean you can plug a hair and put it in the slide and put a drop of liquid paraffin and you can evaluate. You can be able to see the fungal hyphae in the base of the hairs or in the side of the hair material, and also you can go for any culture and sensitive culture examination. So this type of dermatophytosis, they will very well respond to Whitefield ointment. So you can apply Whitefield ointment within 2 weeks. Complete complete recovery will be noticed in such a type of cases. And also you can apply some povidone iodine regularly. So Whitefield ointment one time and povidone iodine one time. External application will be very much fruitful. And other symptomatic treatment, supportive treatment you can carry out with vitamin A supplementation. So the specific treatment include Whitefield ointment with povidone iodine. Alternate. Either you can apply this one in morning and this one in evening. It's a very good result. It will be that. The next condition